All right, everyone, it is time. Thank you for being here. We'll appreciate it if you begin to turn your attention up in this direction. For those of you who I don't know, my name is Rick Allen. I'm the facilitator of this group right now. This group is what we call the Ahwatukee Power Partners. We gather here every week, not just on the fourth Monday like we are today, but every single week as a networking group, a referral group to pass referrals to one another, to help one another grow. And so if you're here today as a guest, thank you very much for being here. If you'd like to take a look at possibly joining this group, let's talk afterwards, and I'd be glad to help you with that. So Power Partners, we have a mission here that, and no, I'm not going to quote it for those of you who know it, because I haven't memorized it, but we're here to help each other grow, to help one another get referrals in our respective businesses, and to help the community and the people that we serve. So with that said, on the fourth Monday, each and every month, we do what we're doing here today, and that is what we call the Idea Factory. And so I'm going to let John go ahead and talk about that. I'm going to hand over the microphone here.
All right, now I've got the microphone.
He's got the microphone.
Now we'll never give it up.
That's okay, I got my own.
Oh, no. So I'm John Nauman. I'm the facilitator for the Idea Factory. So part of the things, the purpose of Idea Factory was born through the Ahwatukee Power Partners. Our goal was to help bring in expertise from outside and inside our community to help share their experience and knowledge so that we could help take that back to our business with at least one idea to help us grow our business. So without further ado, I wanted to do an introduction for Darryl Jacobson-Barnes. She is our local insurance representative. She is with All-Star Insurance Agency and with over 40 years of experience. So we have definitely an expert here today with regards to this. She's going to be presenting today on how to maximize your insurance benefits. So I'll now hand it over to Darryl.
Thank you. Oops. If I can get my mouse to work, we'll be doing good. So we're an independent agency. We're not here today to advertise our agency, though we're here to kind of give you some ideas that you can use in your business, whether you're one of our clients or whether you're somebody else's. I think that there's a lot of things that people can benefit from. As John mentioned, we've been in the business for 40 years. And so we're hoping that we can help mentor some of you and help you with getting the most out of your insurance benefits. John gave a little bit of my background, but to give you a little further of my background, a lot of you who have been here before know that we have friendly rivalry because I'm a U of A person and Andy is ASU, and we won't hold that against him. But what you might not know is I'm also a CLU, which is kind of like a CPA. We have an accountant in the room, but it's for the insurance industry. So basically, there's 10 graduate level courses that you have to take, and then you take tests on each of them, and then there's, and you have to pass each one of them, have a minimum of 5 years in the business, which obviously, being older than dirt, I have way more than that. But I did get my, I actually completed all of my CLU classes before I was old enough or had enough time in the business to get it conferred. So I had to wait to get it conferred until I had the 5 years. I also serve as a property tax appeal judge. So I hear level 2 property tax appeals. And why that's relevant here is because some of my training is in valuation and things that relate to your business as far as from your business continuation and your employee benefit planning and also employment law, because that can affect the value of your business if you're not doing things right. So that's a quick overview. Getting into the meat and potatoes of the topic today, one of the things that people forget is we call it employee benefits, but people don't necessarily think about when they're paying for this, and you pay a good chunk of money to provide employee benefits for your employees. but is it really a benefit? If your employees don't understand it or don't perceive it, and it's just something that they expect without understanding how to use it or what it does for them, then you're paying for something that really isn't a benefit. And what one employee needs or feels is a worthy value may not be what another employee needs. You might have somebody that's older and has a chronic condition, and so they absolutely understand what the insurance is doing for them and why it's a benefit. Then you might have somebody younger who never goes to the doctor, hates doctors, doesn't want to take the time for doctors, and so to them, it's like, why would I need this? I'm a walking accident to happen, so I can give them lots of illustrations on that. I did a stress fracture on my foot and broke 2 toes last week, just to prove the point for today, but hence why I'm clutching the chair. But it's so having somebody that can help give your employees the ideas of what they're actually getting when you provide them a benefit is really important. And it's also important to know what's important to them, because sometimes you might not want to offer all benefits. Like one of the people in the room who's my client, we started with dental because that was what was most important to some of her employees. And so we looked at that. She listened to what her employees wanted, and until it was fitting for the budget to add on health insurance, we started with that. Nothing says you have to, when you're doing a benefits package, nothing says that you have to start with medical. And a lot of employers think that they have to provide medical, that's the key benefit, and if they don't do that, then they just do nothing. But you can attract a lot of employees by offering some of the other types of benefits. And sometimes you'll have a business that's struggling or they're new. They don't have the budget to fit things in. So you can still provide a benefit that your employees will perceive as real just by giving a voluntary benefit. So for instance, with dental and vision, if you look around this room, we don't have very many people with glasses. But a lot of times, if you go to a company that has a lot of people that are working on computers, you look around the room and almost everybody has glasses. So if you're in one of those kinds of companies, you might say, I'll bet these people might like vision. We can maybe do a vision and dental package, do it on a voluntary basis, because the cost of doing individual vision is expensive, because the carriers know that if you're doing individual vision, nobody's going to take it if they don't need glasses or contacts. But if you're in a situation where you're in a group, you get a better rate because they know not everybody's going to use it. And so it kind of balances the costs out. The other thing is, a lot of times your employees don't know that they can get individual dental or that they can get individual vision, so they don't even think about it. And so the fact that you're providing it even on a voluntary basis, they're getting the benefit of a group rate, so it's discounted because you've got the economy of scale of having more people to purchase it, and likewise with the vision plan. So a lot of times what you can buy in the individual market isn't as good a benefit as what you can get in the group market. And also you may not be able to get plans that have as wide a network for lists of doctors if you're doing something that has a preferred provider network. So that can be something that can be very much perceived as a benefit when you're working with a tight budget. I like to say that we take the mystery out of benefits. My son-in-law sometimes would disagree with me because he'll say I use too many acronyms. Our industry is full of 3-letter words that to us is a language, but to the average person out there is not. And so it's oftentimes important when you have plans, and a lot of times the carrier literature comes out with all of those 3-letter words. And you give that to your employees, and they look at it and they don't have a clue what it means, and it goes in the desk drawer. They stick their card in their wallet, and they never have a clue what they just received. And so again, it's not perceived as a benefit. So what I like to say is, even no matter what, there's going to be different benefits, like EAPs is a standard 3-letter word. It stands for Employee Assistance Programs. And what it does, and typically there's an an EAP in most group plans that are over 5 lives these days. What it does is it allows your employees to go and get help with something that may be bothering them that they wouldn't otherwise go get help for if they didn't know that it was covered, and they can make a phone call and they can talk to someone. Where that can be really important oftentimes can be in the morale of your whole business, because if you've got a situation where you've got an employee and maybe they're unhappy with their supervisor and they don't know what to do about it, but they don't want to come public at the workplace, so they can call the employee assistance and talk to them about that problem. And as the saying goes, you can't change other people, but you can change yourself. And so sometimes by getting that assistance, it'll help them learn what they might be doing that might be exacerbating the problem with their manager. And so sometimes that can really help your outcomes for your employees. So it gives you a benefit that you don't necessarily think of as an employee benefit, but it does help you with that. Another one that's great, a great benefit for both the employees and for the employer, is the telemed option. And pretty much all group plans come with that now, where you can add it on for about $6.50 an employee a month. So it's a very reasonable benefit. But what it does is it allows your employees to make a phone call 24/7 to get medical care or medical evaluations on certain things. So you might have somebody that, for instance, maybe thinks they have a urinary tract infection, and appointments for their doctor are 6 weeks out, and so they're suffering and they're miserable and they're cranky to your customers. But if they could be able to pick up the phone and say, hey, I've had UTIs before, this is what my symptoms are, this is what I believe I have, and the doctor says, yep, that's right, and they can call in a prescription that night, and they can go pick it up at Walgreens and get it started before they go to work next day and already start being on the mend. It does a couple of things. It keeps them from taking off a day of work in order to be able to get that care, and it gets them getting the care as opposed to suffering and bringing their misery into your workplace. So from an employer standpoint, again, it helps keep your attendance up, and it helps keep your attitude of your culture of your business, but it also helps the employee because they're getting the care they need, and it doesn't end up getting into a bigger problem. And so ultimately, that can help you also on your renewals if you have lower claims rate. Another thing to keep in mind when you're looking at making sure that people understand that they truly are getting a benefit from their plan goes back to communication. And by having better communication, you're going to get better utilization, and you're going to get more appreciation. So for instance, when we were talking about the telemed, a lot of times that's on a plan, but the employee never bothered to read the brochure that came or their welcome packet. They might not have even signed up for their portal to know what's in it. And so if you don't communicate those things to them, they're not going to know that they have that benefit, and it's not going to get used, even though it's a very good benefit. The other thing is a lot of times employers will give choices. They might have a traditional medical plan with deductibles and or copays, and they might also offer a high deductible plan, which is known as an HSA, another one of those 3-letter words. HSA stands for health savings accounts. As an employer, typically those high deductible plans are cheaper because you have a higher deductible and there's no first dollar. But you can fund with some of those savings a health savings account for your employees. And if you have younger employees that don't tend to use their benefits much and they get that savings account, they'll end up using it because it's not a use it or lose it, but they'll still look at it and they'll go, oh, wow, I have this. Maybe I should think about going to the doctor because I haven't gone for my annual physical, or I haven't gone for my well woman checkup, and I've got $300 sitting in my account, and I've got insurance. Maybe I'll go ahead and do it. And so, again, oftentimes things will get caught sooner. And also the perception when you have employees that are basically healthy and don't tend to have claims or use it, and they see that money building up, all of a sudden they feel a benefit even without getting sick or without getting injured. So that can be something that we can look at. Core value plans are a little different, and I'm not going to go into a big discussion about it, but core value plans are plans where The plan is tied to a fixed rate of reimbursement. Typically, when you see those, they're tied to somewhere between 130 to 150% of what Medicare will pay. Those plans save the employer a lot of money, but those can cause big problems with the employees because most doctors' offices don't understand them. And so on something like that, you're going to want to make sure that whoever your agent is gives explanations, teaches the people how to use it, and explains how to advocate for getting the best benefits and when they need to come back to their agent or the carrier if it isn't covering the cost, because typically it will cover. It's just a matter of the negotiations with the carrier. So again, I can't stress enough communication, making sure that your employees know the resources they have. And if you're a small business owner that doesn't have an HR department, your agent is your HR department. So don't hesitate to pick up the phone, use them, or pass their number on to your employees. Sometimes, especially if you hear an employee complaining about the insurance because they don't think it's covering anything, oftentimes it's because they're not using it correctly, or their carrier may not have billed it correctly. They may have given their carrier. I had one recently where we did a supplemental benefit and we had the regular insurance. And the person was complaining because they said almost nothing was covered and they had had an accidental injury. It turned out they only gave them the supplemental benefit. They didn't give them the primary insurance. So nothing was billed for it. So don't wait until renewal to say, oh, we have these unhappy people. Make sure that if you have somebody that's complaining about the benefits, either talk to them and find out what happened or pass them back to your agent and make sure that they talk to the agent so they can get it resolved and they'll have the satisfaction, again, so that you're not paying for something that is making them unhappy. When it comes to decision time, that's important for both the employer and the employee. And a lot of times employers are busy and they'll make the decision and they think, okay, we're done, we made a decision, we're providing something and you will like it. Doesn't work that way. So it's always a good idea to have your open enrollment meeting, especially if you're offering more than one choice, because if you offer more than one choice, but you don't do an open enrollment meeting, your employee isn't going to understand what they're getting, and so they're typically going to just go with the cheapest plan. And you're not going to have that opportunity for your representative to talk to them about, well, do you take any prescriptions? Do you have kids? Do your kids get sick? Are they babies? Do they need immunization? So that you can make sure that they're being matched up with the plan that's going to best meet their needs. And the other thing when you're doing that decision time is deciding who's going to pay for what. So you may decide, I'm going to pay half the medical cost. I don't want to pay anything for the dental or vision. That's okay. Still offer it. Because that kind of a decision, when you make that decision to still offer it, and it's open and it's voluntary, you'd be surprised at how many employees will take it. I did a group the other day. They got 100% enrollment for the dental and vision. They only got 50% enrollment for the medical. Had they not offered that dental and vision, that 50% would have felt like they got nothing and they didn't get any benefit. And oftentimes that'll make dissatisfaction between employees because the other people were getting, they'd perceive a dollar amount that they're getting. And so you can have people feeling it's not equitable. Whereas if there's something that they can get, they generally feel like they're being treated fairly because there's something answering their needs. And let's see. Again, the other thing that you'll want to talk about is communicating any mandates that you have to trigger the benefits. So if there's something that says, for instance, if you're having surgery, you have to make sure that you get pre-approval on the plan that you choose, or you have to get a referral from the primary care doctor. It's really important that you do that during your open enrollment meeting. Likewise, if there's networks, sometimes employers will say, well, for instance, United Health has a really good network. Let's go ahead with that, but let's take the plan that only gives you coverage as long as you stay within the network, but it's still a PPO because you can go to, it's the PPO network and you can, PPO meaning preferred provider organization, as opposed to a health maintenance organization, which has a very limited network. So they've got that good network, but the person says, oh, PPO, I can go anywhere. Doesn't always mean that anymore. And so if there's something where you have to stay within the network, it's not only important to communicate that they have a network-only benefit, but it's also important to communicate where they're going to find that network. Because when doctor time comes, when they need somebody, they're not going to be thinking about that. They might be asking their friends, their neighbors, whoever, who they should see, and then oops, they're not in the group. So it's important to make sure that they know how to use their benefits. Some other factors that affect the appreciation of the benefits that your employees have is know what they have currently, so that you can compare it. So before you decide to go into a benefits package, if you are a new business or don't offer one currently, it's a good idea to have the employer talk to the employees, maybe even do a survey of the employees. Are you covered currently? Who do you have? Do you like it? Are you happy with the network? Are you happy with the benefits? And you'll get answers back sometimes like never used it, which kind of gives you an idea of, okay, they're not a high utilizing group. Now maybe we can look at a different kind of option based on the responses that you get back that are going to give more of the bells and whistles of the things that you don't have to be sick to use. Or, yeah, I hate it, none of my doctors are on the list. Now you know they're using it or trying to. So you can look at asking them if there's any particular doctors that you can then pass back to your agent to say, okay, these are the doctors that my employees use. Let's find a group that's going to include all those doctors, or a group area rather, so that you can make sure that they'll, again, perceive it as a benefit, as opposed to a lot of times what I see is employers are saying, well, here's my doctors, I'm paying for it, just make sure my doctor's on the list, I don't care about the rest. And so all of a sudden, your doctors are on the list, you're a happy camper as the employer, but maybe your employees aren't quite as happy as you are. So that's important. When you have younger employees, a lot of times they don't have a primary care doctor and they don't know how to find one. So the doctor's list per se might not be as important, but the telemed's super important, because if they aren't using a doctor currently, if they have something, typically where they're going to go is urgent care. But if they have telemed, it's going to help you as far as your loss ratios being when at the end of the year, the carrier might look at what your claims are versus your premiums, and that can affect your what your renewal is going to be. So it's a good idea to have your people only use urgent care or emergency rooms if it's truly urgent or an emergency. And there's a number of reasons for that too. When you go into urgent care or emergency rooms, there's some pretty sick people in there. And so if you broke your toe and you don't need to go to the emergency room and you can just call telemed and they're going to tell you, buddy, wrap it to the toe next to it and wear shoes. That's going to keep you out of that urgent care and getting sick or catching the flu and COVID and RSV and all those other fun things that are going around. The other thing, like I mentioned before, is your telemed's 24/7. Young people love 24/7. A lot of times their schedule just doesn't fit. It's like, I'll use Renee. She's got a daughter. Her daughter, she works full time. Her daughter gets sick. Is she going to take off a day of work to take her daughter to the doctor? Or would she love to have telemed where she could call up and say, is he sick again? It's the same kind of thing she had a month ago. Here's the symptoms. Can you just call something in? And by having telemed and having a history, oftentimes they'll be able to, they might have you put your phone and look at her throat or that kind of thing. As long as you've got a... That's exactly what I do. And I love my telemed. And so for your younger employees, by having something like telemed and educating them on how to use it and how to, the fact that it's 24/7, you're going to have huge satisfaction. And like Renee said, she loves it. Pretty much every young group that I've got, anybody with kids, they love it. And they can also help with finding things. So you might need immunizations for your kid. And again, you don't want to have to take off work for an immunization. And you call telemed and they can look up and see where there might be shot clinics if you're needing immunizations or something for sports team requiring certain shots or whatever you're doing that you need to have something, or even going on a trip where you need to find that. The other thing that I like to say is that it's a good idea to educate your people on planning ahead. So to avoid problems and keep the satisfaction up. So for instance, when you're doing an open enrollment meeting, it's a good idea. If you know the zip codes, some of your agents are going to ask you for that anyway. So we can research the zip codes and come up with the urgent care facilities that are in the network that are in your vicinity, so that I can come in and I can say, hey, NextMed takes your insurance. So you guys might want to write that down and put it in your wallet in case you have an urgent situation. Or this is the hospital groups that are in. So if you have an emergent situation, please take me to one of these, so that you're making sure that you're getting into a hospital that's going to be within network. So those are, again, things that help with your employee satisfaction, because if you can make sure that when they're not in the freak out situation, that they're thinking about where to go and how to access their care, they're going to get that higher level of benefit, and they're going to be happier. So that's, again, going to help with the satisfaction. This slide, I think, is in here by accident. I apologize. But I will hit on it just briefly, because one of the other things that can cause dissatisfaction is a lot of people don't realize that your employee benefits end when you leave the country. And so kids will go down to Rocky Point or wherever, and grown-ups too. But my daughter says, just because I'm older than dirt doesn't mean everybody else is a kid. So from that standpoint, making sure that people don't expect their coverage to cover them when they leave the continental US, that if they're going down to Mexico, or they're going to Canada, or they're going on a cruise, they need to take international insurance. And so that's something also that you can offer as an employer as another side benefit. If you know you're doing a group trip, let's say your company's having an awards conference and they're taking you to Puerto Rico. Well, Puerto Rico is technically a U.S. province. Let's say they're taking you to Jamaica. Oftentimes people don't realize that when they go to Jamaica, they need to get coverage in case something happens. So we can offer a group benefit for those kinds of things. We can offer a group international coverage to cover that group that's going on that trip. Likewise for missions and so forth. So that's something to keep in mind. And also, if you've got a group where the kids are going on missions, they might want to, especially if the kid's going to be gone for 2 years, they might want to know that they shouldn't be putting the kid on the benefits, because the kid's not going to be covered if they're out of the country. So we can do an international plan for that instead. But knowing that ahead of time so that they have realistic expectations is important in keeping them happy. The next slide that I wanted to talk about is knowing your limitations and accepting them. So, I mean, we'd all like to be able to offer everybody the Taj Mahal, but know what your budget is, know what you feel comfortable paying for, and give yourself some wiggle room, because the worst thing to do is to offer some benefits and then all of a sudden decide we can't afford this and we have to pull the rug out. Or being in a situation, I have one client, it's been a client for probably 20 years, and so in this case, they probably couldn't have planned for it. But during COVID, everything was shutting down. It affected their business drastically. And all of a sudden, they started working the float for their premiums. And what happens when you work the float, a lot of businesses think, oh, no big deal. I'm sure you see it in accounting all the time with the books. I've got a 30-day grace. The problem with that 30-day grace is that if you're working that 30-day grace, your employees' claims are being held until you pay that premium. So it's important to understand how that's going to affect them, because if their claim gets held, then their doctor's sending them a notice and saying, gee, we want to be paid. We haven't been paid. And they're thinking, well, I had insurance, what's going on? And they don't realize, and obviously I'm not going to tell them whose fault it is, but the premium's got to get paid in order. So, that's where I'd research it and then come back to the employer like, hey, get that in today, because their claim's not being released until you get it in. But so that's kind of one of those things where, setting yourself up to succeed as opposed to having a worst case scenario where it's going to fail. And then the other thing is, don't be afraid to shop your plan. Sometimes you'll have a carrier and that carrier will take a big hit because they've had a bunch of claims on whatever their particular plans are. And another carrier that was high before may not have that big hit. So if you want to be able to keep the same level of benefits, sometimes it's worth shopping. And if you have a good solid agent that's been in the business, they're going to know what's happening, because if you have a lot of group clients, you're seeing the renewals all year, you know what to expect. And so you'll know. And sometimes you go with a plan that was very cheap compared to the market and it worked well. And even with that bigger increase than the average, it may just be bringing them up to market rates. So it may still be worth staying where you're at, but don't be afraid to ask the question, because you never know what the answer is going to be until you ask. The other thing is, if you don't understand something in an open enrollment meeting as an employer, don't be afraid to ask a question in front of your employees, because if you don't get it, your employees probably don't get it, because they've got even less experience with benefits than you do. And sometimes just by the employer asking a question in the open enrollment meeting, it'll get the employees to ask too, because nobody wants to be the first one to ask a question. So that definitely helps. And if there's a question that comes up after the open enrollment and you don't know the answer, again, call your agent. Don't guess, because again, that goes back to satisfaction, because you may say, oh, I think I remember what that was, so I'm just going to tell them X. And it turns out that wasn't right at all. And then claim doesn't get paid because they didn't do something right, or it wasn't a covered benefit. So always, use your agents, have the meetings. If you can't have a meeting taking everybody out because you're in a type of situation where you need people on the line or doing whatever, I mean, you're not going to want to stop in the middle of installing a sign to come to a meeting maybe. So work with them, try and find a time when it'll work where they can all meet, or consider meeting one-on-one, doing one-on-one employment, so that you're still having some type of an open enrollment, so that your employees are getting that opportunity to talk and ask questions. The other thing, and this, if you forget everything else that I talked about, because I know I talked about a lot, this is something that is so easy to do, and it really increases the appreciation of your benefits. And that's typically when you buy a benefits package, there's all different kinds of things in it, like the telemed that I mentioned, like the employee assistance, like exercise programs where they'll get a benefit from stopping smoking or doing so many steps or whatever there might be. And typically the carriers will create one-page sheets for each of those extra benefits, I guess, for lack of a better term, even though most of the carriers include them now. But they're things that your employee might not realize if they never go to their portal. And so a lot of people walk every day anyway, and they already have an iPhone and they could easily hook it up to get that benefit. And some of the carriers give a credit card, and you can get up to $100 a year on a prepaid Visa just by doing a few of the things. Huge. I mean, you'd be amazed at how excited people get about that. So having that flyer to put out once a month, putting something out about your insurance, it brings it to the forefront of their mind, and it lets them know, yeah, I really am getting a benefit. This carrier is pretty cool. These things are great to know. Even reminders like how to find the doctors. So one month you might do something that gives the links to finding a doctor. Next month you might do one that's how to get that credit card with the benefits on it. Another month you might do something that lists the urgent cares and their numbers that are close by, just so they have another reference sheet that they'll then have in their email, so that if they didn't listen to you before and put that in their wallet, now, oh gee, I think I broke my toe. Let's see where I can go to get it checked out. Do I go to Telemed or do I do urgent care? And they've got those options. Another one would be the benefits and things that you can use telemed for. So you'd have like a one page on that. And when you're doing that, most agents can provide that if you want it. So use them for it. If you think your guys will read it, and even if you don't think they'll read it, sometimes, especially if you have the spouse's emails, send it home too. One or the other will read it. So that's just kind of another thing to enhance your appreciation of your benefits, remind people that they have it, remind people of benefits that they may have forgotten. Because if you get your insurance in January and you break your foot in August, you may not remember that you have a good urgent care benefit that's going to be better than going to the emergency room quicker and less out of pocket, because you might have like a $50 copay for urgent care and a $100 copay for emergency room. So when you can have those comparisons in a one-page sheet, that's going to help them utilize it better. They're going to have less out of pocket. They're going to be happier. And that brings me to questions. Did I meet my time? Cool.
The best question. What do you advise to tell like employees to do when they go out of the country for the health insurance?
Call me. Get something. If they don't want to call me, call somebody and get international insurance.
Is that something that's done like with you, or is that something that you would say for them to get with insurance companies in that country?
So I'm an independent agent, and the insurance companies that I work with, they're international. And so one of the benefits of getting a US-based international insurance company is the companies that I work with all have translators. So let's say you're at Rocky Point and you don't speak Spanish, and you end up, you're paragliding and you have an accident. And you're now in an emergency room in Mexico and you don't speak Spanish and you don't know how to communicate your benefits. You don't know how to communicate that you've got coverage, and they're wanting cash. And you've got an 800 number that you can pick up the phone and you can immediately get somebody to translate both directions. You can put it on speakerphone and they're going to translate what the doctor's saying. They're going to translate what you're saying to the doctor. They're going to be able to give the doctor information on the fact that you have benefits. They're going to be able to get those facilities paid because they're recognized in all of the different countries, typically, if they're a big international company. And the other thing is a lot of countries now are requiring not just your visa, but they're requiring, as part of your admission to the country, proof of coverage. And so if you buy it US based, we could issue that within less than 24 hours. We can have your visa letter for you and all of the documents that you need for traveling, and they'll be in English. And the other thing is the United States regulates all companies. Not all other countries do, and you can very easily get scammed unless you know what the company is. So you're better off getting coverage here, and it's pretty reasonable because they know the odds of a short period of time. Joe?
I have a question. Curious. Does Medicare offer telemed options?
Some do, some don't. So it just depends. And if that's important, we can make sure that you have a supplement that does. Medicare itself does not, unless you do Medicare Advantage. Some of the Medicare Advantage plans, you're actually giving up Medicare. They're taking the premium for Medicare and they're coming up with basically a limited network with prescribed benefits, but then they have put bells and whistles on the other end to get you to go with that. And because they're taking that premium, you typically have less premium out of pocket, but potentially more at the back end.
So our benefits are unusual. Ours are June 1st to June 1st. So how long in advance is it best for you to meet with the owner, do that kind of thing, and kind of see if they can work with you?
Usually about 60 days in advance, somewhere between 60 and 30 days in advance, you're going to want to know what you're doing. So I recommend starting 60 days so you can start planning and you can know what your renewal is going to be. You can figure out what's going on with your group and know whether there's problem issues that need to be addressed or what direction might be good to go.
What do you use your HSA spending
Any medically necessary expenses and anything medically related. So things like vitamins. If it's medically necessary, so like if you have a heart condition and your doctor prescribes aspirin, even though you're buying it over the counter, then you can use your HSA funds for that. You can also use it for dental. So let's say you're healthy, you've got your HSA, and you want to get braces for your kid, and braces are $5,000, and with your dental plan, you're going to have to pay 50%. So you got $2,500. You could use your HSA account for your whole family. So.
You know what's really weird about HSA? Like I have a membership at Sam's at Costco.
Mm-hmm.
I can buy Sensodyne at Costco with my HSA. I can't buy it at Sam's. Like it won't go through. They'll say not approved. I've got plenty of money in that account. But if I buy it at Costco, there's no issues.
Weird. Yeah.
Programmer
didn't.
Yeah, Costco's in the chamber, Stanford's not.
Yeah, that's why. There you go. But yeah, sometimes it's the programmers don't understand, and Sensodyne typically would be considered medically necessary if you've got problems. So, yeah, Renee.
One, Telemed is really awesome. I've used it quite a bit. I've even used it where I had like I got a bacterial infection in my eye that swelled up out of nowhere. They literally just had me take pictures of my eyes. They sent it in, texted it back to them, kind of thing, and they worked with me over the phone. Got my bacterial eye drops ordered. I mean, I call in the middle of the night when Izzy had the flu one night. I usually can get her back to know, and she's starting to get a little dehydrated. But I didn't have to go to the emergency and urgent care. They helped me get her through it and give me some other suggestions. I mean, Telemed is it's been great. I mean, every hour of the day.
Yeah. Especially when kids have ear infections at 3 a.m. and wake up crying.
Right, and like you said, especially if there's a history of it too, that helps too. Because even with I get bronchitis once a year. Try not to anymore. But I can head it off, call in and say, hey, I've had it for 10 days, which I haven't quite, but then they put me on my antibiotics so I don't get it so bad, and I can get better faster without having to pay a $40 or $60 copay and all that stuff. It's just amazing to be able to make a phone call and just get it done. The Blue Cross Blue Shield thing now with that got taken away with
Dignity. Yeah.
Is there anything you have on the forefront of that knowledge of?
Well, history. So Dignity wants more money than any other providers in the Valley. And Blue Cross tried to negotiate and tried to come up. This seems to be kind of a pattern that we're seeing. It happened in Yavapai County as well. And Blue Cross walked away from it, and 2 months later, Dignity came back in and said, okay, yeah, we're losing too much business, because people were going, okay, well, I'm not going to go out of network, so, if it's not something major. But it typically takes them seeing that they've lost enough business, and there's still a lot of carriers out there that cover Dignity. So it's hard to say how much they'll lose.
What happens with a minor in terms of insurance for them? Like when we go into Medicare, once we're done with our private insurance, and then our granddaughter.
So if you go on to Medicare and your daughter's still, or your granddaughter's still a minor and considered your dependent, we're gonna have to get her onto something different. So it would be a qualifying event at that point that she's no longer eligible, because your employer, you have to have an employee taking it to have dependents covered under the employee.
So around the HSA, I understand that HSA account you can continue to contribute and you can continue to bank it. What if you leave the
Only as long as you have a qualified plan.
Okay.
So if you have, as long as you have a qualified HSA plan, meaning a high deductible health plan, you can still contribute. If you no longer have a high deductible health plan, you won't be able to contribute anymore, but you can still use the funds in the plan. And you can contribute up to your deductible. So I have people that sometimes have an HSA, are changing companies, know that the new plan isn't going to have an HSA, and maybe they were only accepting what the employer did, they weren't doing any match or whatever, they can fully fund it before they leave while they still have the plan in place.
So it is transferable. That's
It's your account. You won't. So HSA accounts, even though the employer may contribute to them, it's not a use it or lose it, and it follows the person that the account's with. It's your account. It's not the employer's account. So if you leave, you get to keep the account.
Which is different from a dependent care because you do use it or lose it.
Yep. Yeah. Oh, Rick.
Yeah, you mentioned one of those magic terms just a moment ago. You said that's a qualifying event. What is that? What does that mean?
Okay, so in order to be able to get insurance on the individual marketplace, there's typically open enrollment, which happens at the end of the year, and you have till December 15th for a January 1 effective date, and you have until January 15th for a February 1 effective date. After that, open enrollment for individual coverage is over, but if you have a special circumstance qualifying event, like mom goes on Medicare, kid's still a dependent, but they're not eligible for employee benefits anymore, that's a qualifying event. It's basically whenever you lose coverage through no fault of your own, then that becomes a qualifying event. Divorce is another prime example. Kid turning 26 is aging out, correct? So anything that isn't their fault. So it's not, I decided I don't want to pay the premium anymore. That's not a qualifying event. I thought I saw one more question. No? Okay. Well, thank you.